Did you know that people with high blood pressure are more likely to get kidney disease? Hello, my name is Jeff. Since you are here, please subscribe, comment and ask any question if you like. The advice I give is always intended to be educational. I am not a doctor, so please check with your own physician. First, though, let's look at what blood pressure is. How does blood pressure work? Blood pressure is a measure of how hard your heart has to work to move blood all over your body. How do you measure blood pressure? Blood pressure is measured in millimeters of mercury and is given as two numbers. The pressure when your heart pushes blood out is called systolic pressure. This is the pressure in your blood vessels when your heart is at rest between beats. For example, 140/90 means that your systolic blood pressure is 140 and your diastolic blood pressure is 90. As a general rule, the normal range for blood pressure is between 90/60 and 120/80. Blood pressure of 140/90 or more is considered high. Blood pressure of 90/60 or less is considered low. Blood pressure is too high. High blood pressure is often caused by bad habits like smoking, drinking too much, being overweight, and not getting enough exercise. If you don't treat your high blood pressure, you may be more likely to get serious long-term health problems like heart disease and kidney disease. The blood pressure is low. Less people have low blood pressure. Low blood pressure can be a side effect of some medicines. It can also be caused by a number of other problems, like heart failure or not drinking enough water. High blood pressure causes the blood vessels to narrow and tighten, which damages and weakens them all over the body, including the kidneys. When this happens, your kidneys can't get rid of all of your waste and extra fluid. This extra fluid in your blood vessels can raise your blood pressure and cause more damage, which can lead to kidney failure. Most people don't know they have chronic kidney disease until they are in stage 3 or later. In today's video, we look at the 10 most important warning signs of kidney problems. Watch until the end to find out how one ingredient can hurt your heart and kidneys at the same time. You feel tired and find it hard to concentrate. If the kidneys don't work as well as they should, toxins and other impurities can build up in the blood. This can make people feel tired and weak, and it can be hard to pay attention. Your kidneys make a hormone called erythropoietin, or EPO, which encourages the production of red blood cells. Red blood cells are needed to carry oxygen to all parts of the body. And not getting enough oxygen can cause brain fog and tiredness. You can't get to sleep. Even though people with chronic kidney disease often have trouble sleeping, not much is known about the exact physical reasons why this happens. One thing is for sure, though, people with chronic kidney disease are more likely to have sleep apnea than other people. Your skin is dry and itchy. One important thing that healthy kidneys do is keep the right amount of minerals in your blood. When the kidneys can't keep the right balance of minerals and nutrients in the blood, the result is dry, itchy skin. You have to go to the bathroom more often. Kidney disease can make you go to the bathroom more than you'd like, especially at night. When the filters in the kidneys get damaged, it can make you have to go to the bathroom more often. Your urine has blood in it. Normally, when your kidneys filter waste out of the blood to make urine, they keep healthy blood cells in the body. But if the filters in the kidneys get broken, healthy blood cells can start to leak into the urine. Your pee has foam in it. Protein is present in the urine if there are a lot of bubbles in the urine, like the kind that you have to flush several times to get rid of. Over time, if you have a lot of protein in your urine, it could be a sign that your kidney filters have been damaged by kidney disease or another condition, like high blood pressure or diabetes. In stages 1 and 2 of kidney disease, this can happen. You have dry, red, and painful eyes. As we've already said, healthy kidneys make sure that your blood has the right amount of minerals and nutrients. When the kidneys aren't able to control how much calcium and phosphate are in the blood, these extra minerals can get into the eyes and make them feel uncomfortable. Your feet and ankles have swollen up. If your kidneys don't work well, you may hold on to sodium, which can make your feet and ankles swell up. You don't feel hungry. Because when waste builds up in the blood because the kidneys aren't working well, it can make you feel less hungry and change the way food tastes. Foods you used to like may now taste metallic, which will make you eat less. You have muscle cramps. Electrolytes are needed to control how nerves and muscles work, keep the body hydrated, keep the acidity and pressure of the blood in balance, and help repair damaged tissue. For example, in order for a muscle to contract, it needs calcium, sodium, and potassium. When the kidneys don't work well enough, these minerals can get out of balance, which can cause muscle cramps. Next, Let's talk about the one thing that affects your heart, kidneys, and blood pressure. Every day, your kidneys clean more than 120 quarts of blood. They get rid of waste and extra fluid from cells all over the body. But if you eat too much salt or sodium, your kidneys will have a harder time doing their job. That's because salt keeps water in your body. When you eat too much sodium, your blood has more water, which puts more pressure on the walls of your blood vessels. This can not only make your blood pressure go up, but it can also hurt the walls of your arteries, which can cause plaque to build up and cause a heart attack or stroke. Do you know what is the main cause of too much sodium? Salt also has different effects on different people. Some people's blood pressure doesn't change much or at all when they eat sodium. But for some people, even a small increase in salt intake can mess up the kidney's ability to control the amount of fluid in the body, which can lead to high blood pressure. People who are overweight, middle-aged, or old are most likely to be sensitive to salt. We also get more of it as we get older. Then, what makes people get kidney disease? Most kidney disease is caused by high blood pressure or diabetes that is not under control. Other things to think about are being over 60 years old and having a history of kidney disease in your family. Next, here is a list of things you can do to keep your kidneys healthy. According to the National Institutes of Health, there are a few things you can do to avoid kidney problems. Make sure your blood sugar stays steady. Keep your blood pressure at a healthy level. Eat healthy meals that are low in salt. Try to stay under 1,500 milligrams of salt a day. Test your kidneys once a year to make sure they are working well. Painkillers, especially nonsteroidal anti-inflammatory drugs like ibuprofen and naproxen, can hurt your kidneys. Don't smoke. Limit alcohol. Regular exercise can help you keep a healthy weight. Did you know that chronic kidney disease doesn't have to lead to dialysis or a kidney transplant? If you liked this video, click like, share, subscribe, and bell, so you never miss a new one. What are you doing to control your blood pressure and keep your kidneys healthy? Leave a message below. We'd be thrilled to hear from you. Thank you and hope to see you back here soon.